like a little horsey clip-clop thing.
Like a...
Right, but we're going to stop. And we're just going to hold it till you count to 10.
We're recording.
Oh, then let go. Thank you. Hi, I'm Shirley Gutkowski, and this is The Spot on Health, and we are letting the community know where to go for health in Sun Prairie. Today I have a special guest, and her name is Sandra Ager, and she is a 2006 graduate of Palmer College in Chiropractic in Florida. She has training in multiple adjusting techniques, including Gonstead, Diversified, Thompson, Pedibon, and Activator. She has specialized training in extremity adjusting, I wonder what that is, advanced training in pediatric and prenatal chiropractic care, and is certified by the state of Wisconsin in nutritional counseling. Originally from Beaver Dam, Dr. Sandy now lives in Sun Prairie with her husband John, daughter Clara, and spoiled Labrador Tika. After practicing in a busy practice office in Madison for 5 years, Dr. Sandy opened Ager Chiropractic in Sun Prairie in 2012, and she's excited to bring her knowledge of health and wellness to the community she calls home. Dr. Sandy is a competitive water skier, has been part of the state national champion Mad City ski team since 2002. So you still ski?
Mm-hmm.
Wow. Prior to deciding to become a chiropractor late in her college career, she studied music and now plays a flute with the Sun Prairie Community Band. She also enjoys yoga, running, and pretty much anything fitness or water related, and reading. Welcome.
Thank you, Shirley. Thanks for having me.
Thanks for making time to come out and be on this health show.
Oh, talking about health and wellness to this community is my job. It's my mission. So awesome. I'm so glad you invited me. Thank you.
I'm really glad you're available. So the first thing I wanted to just kind of talk about is just chiropractic in general, because I have always been like an advocate or user or whatever you want to say of chiropractic, but I was never really fully understanding the scope of chiropractic care until I met a chiropractor at a La Leche League meeting. So I was there talking about oral health for children, and she was talking about how the spine gets developed and how important it is for nursing and have the increase the curve of the neck and with the arm and all this other stuff. And I was like, what happened? Mm-hmm. So I'm very interested in understanding how this all goes together.
Right. Well, I do call myself a family wellness chiropractic office, and the reason for that is that, chiropractic is for everyone. Chiropractic is for all ages. It's never too soon to start. My daughter had her first adjustment when she was 4 hours old, and my oldest patient, as of now, was 99 years old. Whoa. So there's a big span, and it's all, all of the impacts that we endure throughout our life, whether it be from the birth process itself or traumas, falls, one-sided sports, awkward positions with moving, lifting, bending, sleeping, all of those impacts over the course of our lives are cumulative. So it's never too soon to see a chiropractor, but it's really never too late to see a chiropractor either. Mm-hmm. Again, like babies, but the kids have the best chance of being healthy and well if they're checked by a chiropractor early on, and many of the problems that we have as adults can be prevented if we have them checked early.
Right, and that's something that I don't know that a lot of people appreciate, because when I heard her talking, it never dawned on me that an infant would need to see a chiropractor. That was for when you bent funny and you locked up or you had, chronic pain in your back. And my niece had twins, and both of them were adjusted shortly after, and it got me to wondering about my own twins and their birth. And one was upside down, one was breech, and one was not breech. And I think I told you I gained like 25 pounds. I was like almost nothing. And everything was right out here, and the doctor didn't know that I had twins.
That's just such a crazy story,
Shirley.
It would not happen today. It would not happen.
Well, everybody's so hepped up on the ultrasound anymore. Right. And so we didn't really, it wasn't routine back in 1980 or whatever year it was. And so I'm wondering who would have, out of those two, would they have had a more traumatic birth, or Are they even? Is every birth traumatic?
You know, I would have checked them both. Obviously, I wouldn't have said this one probably needs it more than this one. First of all, if you only gained 25 pounds and you had twins in there, and you said you were full term, and they were both almost 7
6
pounds,
pounds
right?
And 7 pounds, yeah.
So it was cramped quarters in there for
Yes, it
those poor little
was.
guys. So I'm sure at some point in that process there was stress on one or both of their spines. Then the birth process itself is traumatic to the baby's spine as well. I would lean towards saying the breech presentation probably was more crucial at that point for a chiropractic adjustment, but all of those circumstances in mind, I think that I certainly wouldn't have picked one over the other.
Well, they should have had some probably kind of an intervention, especially because it was such a big surprise. And then all of a sudden you have to do, everything was different, you know.
Oh my gosh.
It was crazy. It was going to be the first time the birthing room was even used at the Janesville Hospital where we had them. And of course it was not a normal birth, so I had to do all this other hopping around. It was crazy. So I'm glad that's over. It's nice that they're fully grown adults now.
Oh, good.
So, but you have training. Well, one thing that caught my attention was the extremity adjustments. And the other thing was the nutritional counseling. And that's why you have a wellness center.
Right. So the extremity adjustment certification, it's called CCEP, and it's an extra certification that I was able to take while I was in chiropractic school. And at that time, I was really sort of gearing my specialty or my expertise towards sports injuries. Being an athlete myself, a sports injury being the thing that helped me discover chiropractic in the first place, I wanted to be more versed than they would teach you in the normal curriculum in shoulder injuries and elbow and wrist and carpal tunnel and hips and knees and ankles. And there isn't a day that goes by that I don't use that training on probably more than half of my patients every single day. And there's adjustments that I've learned that many chiropractors don't know or don't do because they didn't take that certification. So it really is a valuable asset in my office, and a lot of like rotator cuff injuries that people had sort of lost hope on, or knee problems or hip issues, get better with that care. So I'm happy to share that with my patients.
Well, then it caught my attention because I've had this thing with my foot. That's a whole nother thing that we'll talk about off the map. But I went to a chiropractor because I didn't want to have surgery, and he just looked at me like, "What? You know? Okay, so let's see about your foot. Well, you know, I work up, you know." And I was like, "What is going on?" Because I would have expected to have a higher level of fully understanding. So you're telling me that this is a extra training.
Yes.
An extra focus.
There is minimal extremity training in the normal chiropractic school curriculum, but mine went above and beyond that. So there are some things that I know that some don't.
Oh, well, there you go. I'll take it. Works for me. So what happens at a first visit at your wellness clinic?
The first visit is truly, it's what we call our discovery visit. So when you come in for the first visit, the first thing we do is a consultation. I sit down with you and I say, okay, what's going on with you? What brought you in to see me? And oftentimes in that consultation, we also discover things that you didn't even realize may be something I might be able to help you with. So patient comes in and says, I have low back pain. Okay, tell me about your low back pain. And we go through that. And then the next thing, I say, is there anything else? Or kind of off the cuff, they'll say, well, and I get headaches, or I get this or that. And suddenly we found things that have been bothering this patient or that they've been dealing with that they didn't even realize chiropractic could help. Then we go through our complete examination. And what that entails is a number of tests that tell me how your spine and nervous system primarily are functioning. So chiropractic isn't about just cracking backs, which is what most people think. It's about restoring function to the nervous system, because as you can see in my spine here, there is a nerve that travels out from in between every segment in your spine. And those nerves send signals from the brain through the spinal cord and out those nerves literally to control every single function your body performs. There's not a single other function of your body that would happen without that nerve supply. Your heart wouldn't beat, your lungs wouldn't breathe, your kidneys wouldn't kidney, your liver wouldn't liver. None of those things would happen without that nerve supply. So my job is to locate areas in the spine that aren't moving properly and could potentially be putting pressure on that nervous system and preventing it from communicating with the body effectively. So literally by locating those areas areas that aren't moving properly, and then adjusting that spine to restore that communication between the brain and the body's able to heal itself the way it was designed without any help from the outside in, and your body can function at 100% on its own, doing what it knows how to do by itself without any pills, potions, or lotions, or surgeries, or any of those things from the outside.
Well, that's really important information. So all these little yellow nerves that shoot out, they feed their whole body.
Right. So in my exam, what I'm trying to do by looking at your posture and your balance and range of motion and strength and leg length and orthopedic tests and a number of different things, we determine where in your spine there's potentially areas that aren't functioning the way they should. I also use x-rays. I have digital x-ray in my office that we measure. I measure every single x-ray I take and look at the alignment on each one of those. Obviously, I don't take x-rays if they're not warranted on kids or pregnant women or anything like that, but that is a tool that we have. And then there's also a scan that we do at the end of our new patient visit that we'll be actually showing everyone here in a minute. But all of those tests combined tell me how your spine and nervous system are functioning and help me determine what the best course of action is for your care. So
what happens if there was a bulging disc? Is that something a chiropractor could still work with, or can you unbulge it, or?
Yes, so by restoring proper motion and function to the spine, a bulging disc will oftentimes reduce itself back into the place where it's supposed to be. Is the best way to explain that. So yeah, so in our report of findings, we sit down and explain everything we found to the patient. So I can't technically diagnose a bulging disc without an MRI because x-rays don't show them. Some of the orthopedic tests will allude to the fact that that might be what's happening. And oftentimes we can assume that that's what's happening, but without an MRI, I can't confirm it. Either way, by adjusting the spine, getting the pressure off the nervous system and off of that disc as well, those things tend to get better with chiropractic care.
So and you mentioned when we were talking about the extremities, the carpal tunnel, and I think I read it somewhere that all carpal tunnel comes from a neck.
Not all carpal tunnel comes from a neck, but many times carpal tunnel originates in the neck. The nerves that control all the functions of your hand originate in your neck, in the brachial plexus from C5 to C8 of the neck. And those nerves come together, and some of them literally come together, and there are three main nerves that come down your arm then and control all of the sensation and motor control in your hand. And so one of those nerves is the median nerve, and that's the one that runs literally through the carpal tunnel, which is formed by the arch of the bones in your wrist, as well as a ligament that runs across on the other side. It's kind of forming like an arch like that. So there's a nerve that runs through there, and if there's two places or a couple places where that nerve can become impinged, one is in the neck, one is in the elbow, and one is in the wrist. But by removing an area, by correcting the misalignment that's putting pressure on that nerve, carpal tunnel symptoms improve.
So before somebody goes for carpal tunnel surgery, they should have an evaluation of their cervical spine.
Absolutely.
There's a lot of hygienists that are going in for carpal tunnel. I was just reading on one of the Facebook groups. She's been out for just a few months, under a year, and she's symptomatic already.
Well, you can imagine the posture of a dental hygienist all day, looking kind of over a patient and into their mouth, that their neck would be under their neck would be under a lot of stress. And I happen to have a few dental hygienists as patients and a few dentists as patients, because that posture is not something that goes away. So chiropractic is very beneficial for them.
Yeah. So I guess that's the short end. At least have an evaluation, because it could be in the wrist.
Absolutely. And if
you
it
might
turns
be able
out
to
if it turns
manipulate
out
it,
to be something I can't help with, then I refer you out to your orthopedic surgeon. But certainly you want to do everything possible that you can before going that route.
So the report of findings, so you have like an hour appointment where you do all your data gathering, and
it's
then
about half hour. It's not quite an hour. So about 30 minutes.
And then they come back?
They come back.
Okay, so you sit down and you look at all this and you process it and you try to put all the pieces together. And then you report that then to your client or patient.
Yes, so we sit down one-on-one at that report of findings then and go over all the findings of the first visit. I show them their x-rays and explain what I see. I show them that muscle scan that I mentioned and explain how they are all tied together. And then I present them with my best recommendations for care. As far as, okay, this is where you are, this is where you want to be, this is how I can get you there, this is the process, are you ready to get started? And only then does a patient typically, unless they came in with an acute problem on their first visit, get their first adjustment, because I like my patients and I to be on the same page before we ever start treatment.
Yeah. Well, that's important. So you don't just fill out a 3-question questionnaire when you come to your office and lay down on a table and just get manipulated and sent home.
There's a pretty extensive education process that goes with it, because I want the patients to understand not only what's going on with their body, but why I'm making the recommendations I'm making and why chiropractic care is so important. Because chiropractic isn't just about correcting or getting you out of pain. Chiropractic is about correcting those problems, of course, and getting your quality of life back to where you want it and getting you feeling better, but then also working to stabilize that correction, retrain the spine and nervous system to stay in this new, better, proper position, so that then we can be maintaining a healthy spine and not just coming in whenever there's a crisis.
That's really incredible. There's just too many one-offs. So what happens, I think, in medicine in general is a patient comes in, the patient wants to have their headache go away, and the doctor writes them a prescription for a pill for a headache. These are the pills that are indicated for headaches, and they pick one, and then you go home and you're fine. But chiropractic care usually gets some kind of a nick or comment or something where, oh, you have to keep going back, and it's never ending, and blah, blah, blah. But it's the muscle memory. It's the repeating of alleviating the subluxation, I guess.
Exactly.
And go ahead.
Well, and it's the exact same physiology in the spine as it is in the teeth. So since we've already talked about dental hygienists today, let's just stick with the teeth metaphor. They don't take braces off of teeth as soon as they look straight, because it takes time for all the support, the ligaments and the things that hold teeth in place to re-educate to that new position. And if you want your teeth to stay put once they're straight, then it takes time. And then even then they want you to wear a retainer until you're dead, right? So in chiropractic care, we want to make sure that all the ligaments and muscles and all of those soft tissues that hold your joints in place have a chance to get used to or re-educate to that new position, so that it stays there instead of trying to go back to its old bad habits all the time.
Right, and you're not setting like a broken bone.
Right, no.
That's apart. You're manipulating a bunch of pieces. You've got muscles and tendons and ligaments and all of those different pieces that are, I don't know, interfering, but they're interacting, I guess is a better word, with the spine and with the hand and the foot and all that other kind of stuff. So that's pretty awesome. So you mentioned the scan that you do, and that's what I saw you doing at the health fair a couple months ago.
Yes, yes.
So I was wondering if we could do a little scan and talk about the findings of that scan, because it really elevates, I think, the level of care that you're able to provide, because you have, before and after. You have something measurable.
Well, and the reason I use the scan too in the office is that by using that myovision scan and tying it in with the x-rays at the beginning, I can use that then to check progress throughout the care, as opposed to taking progress x-rays throughout the care, which so many people are getting more conscious about, over x-ray and radiation and things. This scan is completely safe. It's only reading the energy coming out. It's not putting anything in, so I can use it on kids. I can use it on pregnant women. I can use it on anybody that comes into the office every single day if I want to, and there's no contraindication to that, and it gives me a ton of information about how the body is responding to what's going on in the spine specifically.
So I already talked to Philip, our producer, and he said he would allow you to scan him.
Excellent.
So that's what we're going to do. We're going to take a 4-second break here and reconvene with the scanner.
Perfect.
Be right back.
Thank you.
Okay, Dr. Ager is going to do a scan on Phil, and she's using some little gadgets there, and she's going to tell you what she's doing as she's doing it.
Yeah, so these are my myovision scanners, and like I said, what they're doing is reading the muscle tension in the muscles along his spine. So what you saw me doing at the Natural Parenting Expo was just the screening that we do. And that's what I'm going to do on Philip. When we do this in the office, we do have the patient in a gown, and we do a full spine version of this scan. For the screening, we simply do 2 areas in the neck and 1 in the lower back in order to see how those areas are looking and talk about that in a screening environment without having to have the patient change into a gown. So first place we would do is right up here at the top of the spine at about C3. And we get our reading. Good. And then We do one here right where the neck meets the upper back at C7. Look straight ahead for me, Philip. There we go. And we get our reading.
So they're not even attached with a wire?
Nope, these are wireless. And then the last one we do, I'm gonna have you lift your shirt up just a touch, is right here at the lower back. And we get our reading, and that's it for a screening. So it only takes a couple of seconds. The patient has filled out typically some sort of a stress survey or a form that I would have given them in order to let me know what they might be experiencing in terms of symptoms or quality of life issues or whatnot. And then we relate that back to what I see on the scan, which we can go over here in just a minute.
Awesome. Dr. Ager, can you kind of explain to us now what you found doing the scan on Philip's neck and lower back?
I can. So, and thank you again, Philip, for volunteering. I think we're going to get the scan here up on the screen. Perfect. So this was Philip's scan. And on the left side of the screen, you can see what a normal scan would look like. So we would expect there to be a certain amount of tension in your muscles when you're standing with good posture in order just to maintain that good posture. And on the right is Philip's scan. So if you see that legend in the bottom right-hand corner of the screen, there's you can see where yellow would indicate that there wasn't enough activity in the muscles, and he doesn't have any of that, but briefly I'll just explain. When there's not enough activity in the muscles, oftentimes that's an indication that pressure on the nerve from misalignment somewhere is preventing that muscle from firing the way it should. So when we have that, there's potential for instability in that area. That means the muscles aren't active enough to support the spine and properly maintain good posture.
Right.
In Philip's scan, we're all on the other end of the spectrum. So when I see overactivity in the muscles, that means they're working awfully hard to stabilize an area in the spine that might not be moving or functioning the way it should. So he's carrying a lot of extra stress in those muscles. And so when I see this, I say, okay, so we wonder why maybe we don't sleep well or we feel fatigued all the time. Our muscles are working twice as hard just to stand up as they would generally need to, you know? So it's not always an indication that there doesn't have to necessarily be pain for a person to have tightness in their scan. They may notice other symptoms, like I said, like fatigue or trouble sleeping or stiffness, or just everybody says, oh, I sit at a computer all day, so my neck and shoulders are always tight. We can see in Philip's upper back how on the right side he's got some tightness there. He sits at a computer for a big part of his day, and I'm sure that's his mouse hand.
Yeah,
So that shoulder's a little bit tighter, and then we've got compensation to the other side in the neck. In the lower back on the left side, he's got a lot of added tightness. So I didn't get a chance to talk to Philip about daily habits or routines, how he might be sitting in his vehicle or what side he sleeps on, or those sorts of just daily mundane habits that we don't even really think about. But we could probably, with just a few-minute conversation, narrow down why his tendencies are going the way they are and what we would need to do to correct them.
Yeah,
and also if I had, like I said, the x-rays of his spine, we could tie together. I could say, see how your sacrum is turned this way and your pelvis is turned that way? That's why these muscles are tighter on the left side, you know?
Right, you put this down, that's in 2D, and we're working with a 3D body, obviously. So is it uncommon where there'd be a lot of red on one side of the cervical spine and then red on the opposite side on the lower?
So we see that a lot, actually. The spine is all connected, and a chiropractor who's doing their job is going to be looking at the person as a whole and not as a bunch of individual parts. So when I look at that, I can see that, so there's stuff going on the left side, and so the stuff on the right side of his neck could be compensating for what's going on the left side of his lower back, or vice versa. It's sometimes a chicken or the egg question. And sometimes we have to get into the history to find out which one was the chicken and which one was the egg.
Well, it's so interesting to me too, and this is, you know, again, how all the pieces all fit together, that a lot of the questions that you were just mentioning are also questions that I do in my work. So, you know, with the neck pain, a lot of, on occasion, you would see a tongue tie situation, for instance. So that kind of goes together with that. So that's why it's important that all of these healthcare providers work together and network together to address all the different parts, because you're not a pillar, you're not a silo, I'm not a silo, the whatever all isn't a silo, so we have to kind of work together a little bit more, and that's what I hope to do on this little TV show. So let us know where your practice is exactly. What's your address?
We are at 948 West Main Street right here in Sun Prairie. So the strip mall, main shopping center right next to St. Vincent de Paul's thrift store is where we are. We're right next door to Golden Days Bakery. So if nothing else, come visit the bakery and then stop in and see me.
And there's your phone number right underneath there
Yes.
too. So that's good. So it's really easy to find, and you have a nice sign out in the front, and we showed the sign on the front of your building too.
Thank you.
So what else happens there? I mean, we talked about wellness, we talked about your basic chiropractic. What else do you do? I know you said that you were playing in the community
Band. Yep. So we do a lot of community outreach in the office. A couple times a year we hold an event called the Patient Appreciation Day. And that day is always donated to a local charity. In the past year or two, it's basically all been Sunshine Place. Every year around the back to school time when they're doing the Stuff the Bus campaign, we do a day where we donate all of the services from that day towards school supplies for Stuff the Bus. So the patients are to bring in school supplies in order to pay for their adjustment on that day. And that whole week, typically any new patient that comes in, a donation, either money donation or a school supply donation, gets them that whole first visit that we just got done talking about, Shirley. And just recently in February, we did a food drive for Sunshine Place. And it was the same kind of a thing where everybody had to bring in food donations or monetary donations for Sunshine Place, or we just donated what they paid for their adjustment that day back to the food pantry. So we were able to give them about, I think it was just over $2,000 worth from just that one day.
Wow.
So it was, we have a lot of fun with that. We've donated quite a bit to American Family Children's Hospital over the last few years. So we try to do a lot of our marketing and whatnot when we're out doing events and things like that. We always donate a portion of the proceeds from those events, and when people invite us in to do talks and things like that, back into the community in order to just help the community as much as we can. So
that's awesome. It's really important, I think, that the community understands what you're doing for the community as well. And this is part of that, and I hope that you'll be able to come back and maybe talk about another piece of the practice that you have at your wellness center. That's terrific.
The last thing we just haven't mentioned yet is that we do have an excellent weight loss program in the office. So as part of a wellness center, you can't address spinal issues in many cases without addressing, pardon my pun, but the elephant in the room. A lot of people that have weight issues have back problems. So we do have just really effective, supervised by me and by a coach that is employed by me in the office. You come in for weekly weigh-ins, and it's just, there's a lot of support, and it's been very successful. So probably not something we have time to talk a whole heck of a lot about today.
Try that another time.
But it's just another part of the wellness center part of practice.
Excellent. Thank you so much, Dr. Ager, for joining me here on The Spot on Health. This is Shirley Gutkowski, your host of The Spot on Health. And I encourage you to share these shows by going to sunprairiemediacenter.com. And this is the show that lets the community of Sun Prairie know where to go for health. Thank you very much.